if this bill is repealed?
You mentioned the donut hole, the prescription drug donut hole. Every senior that's in the prescription donut hole last year, 2010, received a $250 check to help them pay for their drugs. And going forward, the donut hole will be lessened and lessened, and eventually, 9 years from now, will disappear. There'll be no donut hole. You talked about the quality of care, extremely important quality of care. Thank you for bringing that up. More primary doctors, more geriatric care of nurses and doctors, extraordinarily important part of the legislation, not just only for seniors. You also mentioned the community-based and, of course, the preventative care. All of these things are there, and all of them will disappear if the Republicans are successful with their legislation next Wednesday that will be brought to this floor without one hearing to discuss any of these issues in a relevant policy committee. Mr. Cohen, please join us.
Let me ask a question. I was just thinking here, as I'm honored to be in the House of Representatives, and with a Constitution that's so beautiful that it says we're to promote the general welfare, we are among other industrialized nations on this earth. What do the other industrialized nations in the earth do about health care for their citizens?
Well, I'm not sure I heard your question, so please say it again.
What do the other industrialized nations in the world do for health care? Do they have program policies like ours where 32 million people don't have health insurance and they're not mandated to get insurance, or what do they do?
Well, I think you're asking me a rhetorical question because you know the answer, and I think most Americans know the answer, that all the industrialized nations, we're not talking about China here, but we're talking about Korea, Japan, the European countries, the European Union, all of those countries provide universal health insurance coverage. Universal. Everyone, including tourists who happen to show up, and this I know from one of my daughters that fell off a stair at the Leaning Tower of Pisa. She was leaning too far. She fell, went into an emergency room. They took an MRI, bandaged her up and said, "Get out of here." And she said, "Well, I haven't paid." She said, "You're covered." And that was in Italy.
And does the United States not have one of the greatest discrepancies in wealth between the richest and the poorest in the industrialized world as well? So are we saying to our wealthy people, you can afford health insurance so you can get it, but for those people that are poor, too bad?
They don't. The other countries of the world don't look at it that way. They look at it as a right for their citizens to have access to health care, and they provide the health insurance. Different ways of doing it. Germany, France, Britain, Canada all do it differently, but they all do it. And incidentally, the health statistics in all of those countries are considerably better than America, and America is placed at the bottom of the industrialized countries in terms of our health care, how healthy we are, how long we live, how sick we get. We're at the bottom. In fact, we are often with developing countries in the statistics. We spend almost twice as much as any of those other countries. So the Affordable Health Care Act goes after many, many things beyond the Patient's Bill of Rights and the senior issues. Thank you so very much for raising that issue. We have about maybe 10 more minutes. 10. Then let's go. Mr. Pallone.
Well, I just wanted to talk a little bit about prevention, and particularly in terms of seniors, which you mentioned, and what it means in terms of people's health and also the cost to the government. Because some of the things that we've mentioned with regard to seniors have already taken place. You know, this summer, under the bill, seniors who fell into the donut hole got a $250 rebate. Beginning January 1st, they get a 50% discount on brand name drugs if they fall into the donut hole in 2011. You mentioned the co-pays for preventative care, whether it's your annual wellness treatment or other kinds of tests like mammograms or colonoscopies, for example. The reason that we're eliminating the 20% copay for these things, the reason we're trying to fill up the donut hole, it all goes back to prevention, because if people get their drugs, then they don't end up getting sick and going to the hospital. If they get these tests or they have the annual wellness checks, they still stay healthy. They don't go to the hospital. And when they go to the hospital, if they're on Medicare, it just costs the government more money. So, you know, this is the way we save money. We save money. What does that mean? It means that the debt is decreased. It means that the solvency of Medicare you have on the chart is extended. You know, I don't know if we've talked much about that. It was one of my amendments on the Rules Committee today, is, a lot of seniors tell me, and they come up to me and they say they're worried about the fact that, Medicare may become insolvent and there wouldn't be enough money in the trust fund to pay for it. Well, the bottom line is that the health care reform bill extends the judgment day, if you will, when the solvency problem becomes an issue, much further. And if you have the repeal, the solvency problem hits us 6 years from now, in 2017, from what I understand. So another problem with repeal is not only does it sit, but it also, is only 6 years from now that we would have to deal with this Medicare solvency problem. And what is that going to mean? That's going to mean probably that cutbacks in benefits for senior citizens, because if you don't have the money, you're going to have to cut back on the benefits. It is amazing to me how they can continue to talk about this repeal. The other thing they keep saying on the other side of the aisle, the Republicans say, well, the reason we want the repeal is because this health care reform is killing jobs. Nothing could be further from the truth. I mean, the fact of the matter is that under this health care reform, because the cost of health care premiums for employers will be significantly reduced, they'll be able to hire more people. I mean, part of the problem that we have with competition with other countries, you mentioned all these other countries, all these other industrial countries that have free health care, universal health care. Well, that means that the employers don't carry the burden of that. So when they hire someone, if the government's paying for it, they don't have to worry about that for their employees necessarily. Well, if the cost of premiums go down, then people, the cost of hiring somebody goes down in the United States. In addition to that, there are all kinds of jobs created in the healthcare professions, because as everyone gets covered and everybody needs a primary care doctor, well, you're going to need more doctors, more nurses, more health aides, because people will get that kind of preventative care. So there are jobs created with the preventative care in handling people to make sure they stay healthy or they stay well. So, I mean, it's unbelievable to me when they talk about repeal. I mean, they should be, what the Republicans should be doing is spending the first few days of this session talking about how to improve the economy and create jobs, not repealing health care. It's just I think American people have moved on. They don't want to hear this. They want to know what this Congress is going to do to create jobs and improve the economy. We've already dealt with their issue, and they want us to move on. I yield back to the gentleman.
Thank you. We have about maybe 3 minutes, 4 minutes. And I'm going to turn to Mr. Cohen and Ms. Edwards. Would you like to say close? Okay.
I just wanted to add one thing. Thank you. Mr. Pallone brought up an issue, and he said that it was not true that it was costing jobs. There's some respected group, I think it's called PolitiFact, and they were on national news giving the biggest lies told in politics in the last year. And the number one biggest lie, this independent group, was the Republican mantra of government-run or government-mandated health care. And it's just a fact. That's the biggest lie told the American public, and it came from the leaders on the other side. It came from these halls where they're immune from defamation suits, because it's not government-run health care. And it's unheard of, unfathomable, that the other side would use the fact that they are immune from prosecution in any other jurisdiction or court for words that aren't true, to do that in politics, to say it was government-run health care. The biggest lie of 2010, and it comes to the floor next week, Mr. Garamendi.
Well, we're going to wrap this one up. I see Mr. Yarmouth is here, and he'll probably carry on with health insurance, and I don't know, maybe a couple of us will be asked to join him. But we really today focused on a broad range of issues: the Patient's Bill of Rights, the way in which the repeal would harm individuals who have pre-existing conditions, young children from infancy, the 23 to 26-year-old coverage. We also discussed a little bit about how this affects business, and of course we went into some detail about senior citizens. All of these are critically important issues. We'll be discussing these in the days ahead, and I do hope the American public will really pay attention, because this next week, particularly as we move towards Wednesday, is going to be absolutely critical to the American people. It's a question about, will all of us in America be able to get health care coverage that is affordable and provides us with the opportunity to have the health care that we need. So with that, I will wrap this up and turn it over to whomever is next. Thank you, Mr. Speaker. I yield back my time.